community health nurses, we are trained to always maintain the safety of our patients. Today we will be addressing the safety of the home care nurse in the community setting, which is part 1 of this community health nursing module. The objective of this course is to identify the potential safety issues for the home care nurse as they are caring for patients in a community setting. This course will enable the student with the analytical skills to assess the environment and critically think of ways to decrease or prevent risk of injury to self. 4 main safety issues for the nurse will be addressed in this module: musculoskeletal disorders, exposure to bloodborne pathogens, and needle sticks, violence, and inclement weather. The first safety issue that will be addressed is musculoskeletal injury. Risk factors associated with musculoskeletal safety are weight, lack of assistive devices, patient and or family resistance, and time restraints, which can cause the nurse to rush. Prevention methods should be utilized to decrease the incidence of injury, which are the use of good body mechanics, the use of an appropriate assistive device, such as walkers, wheelchairs, gait belts, sliding draw sheets, shower chairs, raised toilet seats, grab bars, mechanical lifts, and adjustable beds, and the utilization of the home health aide or available family members to assist with care. Remember that it is important to not provide care if you are unable to manage the patient independently. In the event caring for the patient is unsafe to the staff, you should contact your supervisor immediately and identify if the patient is not a safe home care candidate. The second safety issue is the exposure to bloodborne pathogens and needle sticks. These risk factors include the use of needles that must be manipulated or recapping, glass equipment, lack of sharps containers, time restraints, and distractions such as children, pets, and family members. Prevention methods that should be utilized are bringing your own sharps containers and using proper sharps disposal techniques, maintaining compliance with standard precautions, use of retracting needles and lancets, and never to recap. It is important to educate patients on appropriate items for sharps disposal, such as laundry detergent bottles. Coffee cans and milk containers are prohibited for this use due to insufficient protection being provided. The nurse must always carry personal protective equipment, stay up to date with vaccinations, and control the environment, which means you may need to provide privacy for the patient and yourself. The third safety issue is violence. Keep in mind that your employer may not be aware of the risk involved when dealing with the patient, so being able to assess the environment is essential to the home care nurse. Some risk factors include an unpredictable environment, which can be a high-risk neighborhood, firearms in the home, presence of an aggressive animal, and aggressive family members. Psychological and psychiatric issues of the patient or family, drug and alcohol abuse, and dysfunctional family dynamics may also be a risk factor. Prevention methods that should be utilized are the assessment of the environment for risk factors, to always keep your cell phone on hand and maintain access to an exit. You should also use de-escalation techniques, which are to remain calm, remain neutral, and not engage in argument. If feeling unsafe or threatened, depending on the level of severity, you should respectfully limit the time of your visit or remove self immediately. If you are visiting a known high crime area, you can decrease risk by working in pairs, scheduling visits during daytime hours, parking in well-lit areas, keeping personal belongings out of sight, and keeping doors locked and windows up. If you feel unsafe, do not get out of the car and contact your supervisor immediately. Lastly, we will address the safety issue of inclement weather, which is a common experience in community health nursing. Risk factors include traveling in the snow, heavy rain, icy conditions, and extreme heat. Prevention methods include the use of main roads, keeping up on your car maintenance such as snow tires and adequate windshield wipers, and being aware of weather changes such as impending storms or extreme heat. The use of seat belts and hands-free devices for cell phones are always required. And you should limit distracting activities such as eating, drinking, or applying makeup. car kits accessible, and wear appropriate clothes and shoes while utilizing fall precautions when walking on snow, icy, or wet surfaces. These safety issues are not all, but some of the common issues that can affect a nurse's safety when working in the field. It is important that the home care nurse keeps their own safety in mind when caring for patients. After the completion of Part 1 of this module, we will then address Part 2, which is maintaining patient safety.